my name is Marianne Opes. Today we're going to talk about the taco technique of placing the new Cleanse Choice Complete foam that looks like this. It's all fused together into a wound in an arm that kind of has some depth to it. And so I hope you guys will enjoy that. If you want to subscribe to this YouTube channel, we'll send out information when we make new videos. You can also send me notes in there if we ever want to chit chat, if you have any questions or if you have better techniques that you would like to share, that would be amazing. So we're going to go through this presentation, kind of looking at the taco technique in real patients. I'm kind of going through this because there's a lot of foam. So we all know the black foam and the white foam, which is impregnated with saline, has a little more density to it. You can put it over things you don't want to dry out or protect, like vessels and tendons and that kind of stuff. Then they have the foam that is Instillation, but there's no little holes in it. And so we don't actually carry this foam anymore in our hospital. And then there's the Cleanse Choice foam, which has got the holes that are kind of a separate piece and then cover layers. This is the intra-abdominal dressing that has foam and a visceral protection layer that you actually put in the belly over the bowel. And then the new Cleanse Choice Complete, that's the one we're going to do today. And the incisional ones are the purple ones, and they're meant to go over closed incisions. Drape updates, we all know our standard acrylic drape, and then they have a different drape that's also acrylic for installation, and then the new Dermatac Drape that you're going to be seeing today, which is this hybrid of silicone and acrylic, and it has a lot of conformity. You can put it down and bring it back up, so it's slick to use in those situations. And let's talk about new track pads. We have the normal track pad that we all are aware of, and the Instillation foams, doesn't matter what kind. If you get a large foam dressing, they're separate. The Instillation has its own tubing and everything, and then the negative pressure is just a standard track pad. But in the medium one, it's actually together. So the Instillation and the negative pressure go together into one track pad. So these are the kind of patients that we generally would use the taco technique. So this is a hip. Obviously, anyone that we're going to instill, we're going to border like this patient here. This is a gunshot wound. And also in these big areas underneath an abdominal wall injury, you could do the same thing because you really want those holes to be against the wound, both on the top side and on the bottom side. So let's get to the taco technique. Okay, we wash the whole surface of the wound with hypochlorous acid, repairing it, allowing it to dry. We'd pre-measure our foams. The ones with the holes, we really want it to go into the wound and touch the wound surfaces. So I'm going to put it in like a little taco into the wound, like this. And then I'm going to put a cover one to land our track pad on. But before we do that, we're going to actually protect the peri-wound skin by placing down some Dermatac. We're going to put this down just to protect the peri-wound skin. We're going to cut the interior free, but we're going to leave 1 centimeter hang into the wound bed because then when we take this dressing down, it will be less painful for the patient and it helps us to get a nice seal. So we leave it hang in the wound bed and then we gently close it all along. This little guy gets a slit because I want it to lay down nicely. So I'm going to put this in like a taco into the wound. But I don't want to put my track pad on here because it'll bend this and we'll have some alarms. So we're going to add, because we prepped the entire surface area, we're going to add this nice big piece of foam over the top. And then we're going to just let this drape fall down nicely onto the patient's skin with no pulling. Straighten it out if we need it. If we have little wrinkles, you can certainly just pick it up and straighten them out. And then you want to cut a nice landing zone for our track pad. And then I like to smooth this down nice. And then your dressing is on. Thank you so much. I hope you enjoyed the taco technique on an arm and the demonstration. Thanks to Barb Carlson and the Regents Hospital Sim Center for letting us use their mannequins, which is amazing. And I hope you enjoyed it, and subscribe to the YouTube channel if you want any updates. And other than that, have a fun Fistula Friday.